Hi, there is a lot of different Shockwave devices out there. And the biggest mistake I did was that I just took the first and the best I was presented for. And it wasn't a bad device, not at all. I got one of the best devices in the world, so that was really good. But that is where we normally go wrong. We just get the sales pitch and then we go into it. And then we stick with that because this is very expensive devices. So I started with a storage device in 2016. It's been getting me really far. It's been a really good addition to my clinic. It was amazing. I was the Shockwave guy. I thought I was. But 2 years ago, I started opening up my eyes to the other devices. Instead of just saying, yeah, if you don't have my device, then you can't do anything, I started working with other devices as well. So right now, I have the top line. I have the NGS Shockwave electrohydraulic, I have the Wolf piezoelectric, and I have the Storage electromagnetic. And we still have a lot of other devices. We have from BGL, we have from Medispec, we have from Insular, we have from Donier. All of these devices will be able to apply a shockwave, a focused shockwave into the tissue and create a difference for the clients. There can be a difference in quality and mode of generation, but if you really want to talk about shockwave and the understanding of shockwave, it's not enough just to be using one device for 2, 3, 4, 5 years, because there will be a lot of small nuances that you won't get unless you actually have the practical experience. So instead of just going into one sales rep and saying, I want this device, then be sure to use 2, 3, 4 months to trial different devices before you get to a final decision. The most important thing, if you are not able to trial the device for a longer period, is to deep dive into the science and experience from people that's been working with different devices. Because the effects of focused shockwave will come after 4, 6, 8, 12 weeks. So it's not enough to have a device for 1 week and say, okay, I didn't see anything for my clients, because that's not the option. We want to create a biological change in the long run, no matter if it's musculoskeletal or mental, as I focus on right now. So dive into the research, talk with different people, and remember, when you see a video like this, who has been paying for it? I don't talk that much about the electromagnetic system anymore. It's not because it's not a good device, but from a commercial perspective, in some of my activities, it's not what I prioritize. Then I prioritize the 2 other devices where I work closely together with the companies. So look into who's trying to sell. Look into, is it an expert, is it a sales rep? Try to get some different opinions, talk with people that work with several devices. There's not many of them, but we are a few people that actually has more than one device in the clinics. So enjoy Shockwave. Remember to dive deep. There is difference between the different devices, both from the biological effect, the quality of the devices, the prices. So look into what's really good for your clinic. For me right now, with what I do, I prefer these 2 devices because I can get a general stimuli for the ED, the prostatitis, and I can be extremely specific for neurology patients with very difficult conditions, or for Peyronie's disease, where I want to have a very high amount of energy on a specific spot. So use the devices for the right indication, and then it will be amazing with the results. And the clients still need to work with the lifestyle. That is the most important. So Shockwave, it's a way ahead. It's a part of the toolbox. 1 device is really good. If you have 2 or 3, then you can basically do everything within the Shockwave role.